All right, so today we're going to be taking a deep dive into Ohio's laws surrounding HIV criminalization.
Okay.
And we're going to be looking at a report put together by the Equality Ohio Education Fund
Okay.
and the Ohio Health Modernization Movement. And they really try to break down
Yeah.
how these laws are actually playing out in the real world.
So one of the things that's really striking is that Ohio actually has 6 laws specifically designed to criminalize people living with HIV.
Wow, 6. That's a lot.
Yeah, and most of them are from the 1990s.
Really? So we're dealing with laws that are like 30 years old?
Yeah, we're talking about laws that are rooted in a time when the understanding of HIV transmission and prevention was completely different than it is today.
So they haven't really been updated to reflect like current science.
And
Like
exactly. They don't take into account things like antiretroviral medications,
oh, right.
which can actually suppress the virus to the point where it's undetectable.
So when we say undetectable, what does that actually mean?
Undetectable means that the amount of virus in a person's system is so low that it can't be detected by standard tests.
Okay.
And more importantly, it means they can't transmit the virus to others.
So even if you have an undetectable viral load, you can still face legal trouble in Ohio.
Unfortunately, yes.
Wow.
2 of these laws really stand out as particularly problematic.
Okay.
The first one is felonious assault,
Okay.
and this can actually be applied even if someone doesn't transmit HIV.
Really?
All it takes is engaging in sexual conduct without disclosing your HIV status.
So even if transmission is impossible because of medication,
That's right.
that's wild.
The report highlights an actual case,
Oh, wow.
Mindy and Michelle,
Oh,
and it really illustrates just how absurd this can be.
okay.
So Mindy has an undetectable viral load, meaning she cannot transmit the virus.
Got it.
But because she had sex with Michelle without disclosing her status, she's facing up to 24 years in prison.
24 years. That seems so harsh, especially considering she posed no risk to Michelle.
Exactly. It highlights this huge disconnect between the law and our current scientific understanding of HIV.
Yeah, for sure.
And it's not just about sex either. The other problematic law is harassment with a bodily substance.
What's that one about?
This law makes it a crime for someone with HIV to expose another person to their bodily fluids.
Okay.
Get this, it includes saliva.
Really?
So spitting, even though saliva can't transmit HIV, can potentially land someone in prison for 3 years.
That doesn't make any sense.
It really doesn't.
Like, it seems like these laws are kind of rooted in fear rather than facts.
Yeah, you've hit the nail on the head. That's a big part of the problem here.
Yeah.
So the researchers wanted to understand how often are these laws actually being used?
Right.
And what are the real-world consequences?
Yeah. But wouldn't it be kind of hard to track down that information?
Yeah.
It's not like there's a central database for HIV-related prosecutions.
You're absolutely right. The researchers faced a huge challenge.
Yeah.
There's no consistent record keeping across Ohio's 88 counties. So they had to dig through public records,
Oh, gosh.
file mail requests, even resort to Freedom of Information Act requests.
Wow, so they're really digging deep.
Yeah, in some cases, they had to go through court dockets by hand, searching for terms like felonious assault,
Oh, my God.
and then actually sifting through to find cases specifically related to HIV.
Wow, that sounds so painstaking.
It was a lot of work.
Yeah.
But despite all those hurdles, they were able to identify at least 214 HIV-related prosecutions in Ohio between 2014 and 2020.
Oh,
And here's where it gets interesting.
all right.
Over half of those prosecutions were under that harassment with a bodily substance law, the one about the spitting.
So the law that's based on like a misconception about HIV is actually the one that's being used the most?
Yeah, pretty much.
That's kind of alarming.
It is.
Yeah.
And about a third of the prosecutions stem from the felonious assault law, even though that doesn't even require actual transmission to occur.
So it really seems like these laws are being applied in ways that don't align with like what we know about HIV,
You got it.
and that can have some pretty serious consequences.
Exactly. And that's just the tip of the iceberg.
Oh, no.
The report also uncovers some disturbing geographic and racial disparities.
Okay. I definitely want to hear more about that, but
Yeah.
before we dive into those details, let's take a quick pause and we'll come back and unpack the rest of the report's findings.
Sounds good.
All right, so we're back. Before the break, we were just starting to talk about some of the geographic and racial disparities that this report found.
Yeah, so it turns out where you live in Ohio can actually have a big impact on your chances of being prosecuted under these laws.
Really?
Yeah, so for example, Cuyahoga County, where Cleveland is located,
Okay.
accounted for over 26% of all the identified cases.
That's a lot, considering there are 88 counties in Ohio.
Yeah, it is.
Wow.
What's even more striking is that Franklin County, which is where Columbus is,
Okay.
and actually has a larger population than Cuyahoga,
Uh-huh.
had 4 times fewer cases.
So, like, two pretty major counties in Ohio
Right.
with, like, big populations
Yeah.
show a huge difference in how these laws are being applied.
Yeah, huge difference.
So why is that?
Well, that's the million-dollar question.
Yeah.
The report doesn't actually give specific reasons for these geographic variations,
Yeah.
but it does raise some important questions about, like,
Yeah.
local law enforcement practices and, like, how much power prosecutors have to decide who to charge.
Right. So prosecutorial discretion.
Exactly.
Yeah.
And it seems like there's a lot of inconsistency in how these laws are being interpreted
Mm-hmm.
and enforced across the state.
Yeah, it really highlights how even with, like, state-level laws,
Right.
a lot of power comes down to, like, individual prosecutors
Yeah.
and law enforcement agencies.
Yeah, for sure. And that inconsistency becomes even more concerning when you look at the racial disparities that came out in this data.
Right. You mentioned those earlier.
Yeah.
What can you tell us about that?
So the report found that Black men are significantly overrepresented among those charged under these laws.
Okay. How?
So Black people make up only about 12.5% of Ohio's population,
Okay.
but they represent almost 29% of those facing prosecution for HIV-related offenses.
So more than double their representation in the population.
More than double.
Yeah, those numbers are really troubling.
They are, and this pattern of racial disparity is evident in a lot of different counties.
Okay. Like where?
So, for example, in Cuyahoga County,
Okay.
Black individuals made up 2/3 of those charged,
Wow.
even though they make up less than 1/3 of the county's population.
That's a huge difference.
Huge difference.
It almost seems like the law itself is being applied differently depending on someone's race.
Yeah, and that's a really serious concern.
Yeah.
And it points to, like, potential systemic bias
Right.
within the criminal justice system.
Yeah, for sure.
And the report highlighted similar disparities in Franklin County and Hamilton County as well.
So it's a consistent pattern.
Yeah, it's a pattern.
It's hard to ignore.
Yeah, and it really raises questions about whether these laws are being used to unfairly target certain communities.
Yeah, it's a valid concern.
Yeah, and unfortunately, the report also acknowledges that there are some limitations in the data
Okay.
that make it hard to draw, like, definitive conclusions
About what?
about the experiences of certain groups, particularly when it comes to gender identity and LGBTQ plus status.
Oh, so we don't have a complete picture of how these laws are impacting the LGBTQ community.
Right, especially transgender individuals.
Right.
Because official records often rely on officers' perceptions of sex and gender,
Okay.
which can lead to people being miscategorized
Right.
and can really obscure the true extent of how these laws are being applied to trans folks.
Yeah, so there's a real need for more, like, comprehensive data collection to get the full scope of this issue.
Absolutely. Without a more nuanced understanding of how these laws are impacting different communities, it's
Yeah.
possible to develop, like, truly effective and equitable solutions.
Okay, so just to recap, we've established that these laws are often out of sync with science.
Right.
They're inconsistently applied across the state.
Yeah.
And they're disproportionately impacting certain communities, particularly Black individuals.
Yeah, you got it.
So what are the, like, broader implications of all this? Like, what
Yeah.
are the consequences beyond just the legal stuff?
That's a really important question because beyond the immediate impact on those facing charges,
Yeah.
these laws can actually have a really chilling effect on public health efforts.
Oh, I can see how that could happen.
Yeah.
Like, if you're worried about being criminalized, even if you're not doing anything wrong,
Right.
wouldn't that make you hesitant to, like, go get tested or seek treatment?
Exactly. So imagine you're someone living with HIV in Ohio,
Okay.
that even disclosing your status to a partner, even in the context of safe sex practices, could potentially get you in legal trouble.
Yeah.
That might make you think twice about even getting tested in the first place.
It's like a catch-22.
It is.
Like, these laws that are supposed to prevent HIV transmission
Yeah.
could actually end up discouraging people from taking steps to protect themselves and others.
Exactly. And, fear and secrecy thrive in the shadows.
Right.
When people are afraid to talk openly about their status or to access healthcare,
Yeah.
it becomes much harder to control the spread of the virus.
So it's almost like these laws are working against their intended purpose
Totally.
by, like, creating barriers to testing and
Yep.
treatment and open communication.
That's exactly right.
Yeah, that makes sense. And are there consequences beyond just, like, the individual level?
Oh, yeah, definitely.
right.
Think about the stigma that still surrounds HIV.
Yeah.
These laws, by framing HIV as a criminal issue rather than a public health concern, actually perpetuate that stigma, and they further marginalize people living with the virus.
Right. It reinforces the idea that HIV is something to be ashamed of rather than something to like understand and manage.
You got it. And that stigma can have huge implications for people's mental health.
Yeah, of course.
Their social well-being, even their access to employment and housing.
Right.
It creates like a ripple effect that goes way beyond the courtroom.
So these laws might seem like a simple legal matter on the surface.
Right.
But they're actually connected to these really complex social and public health issues.
Absolutely. And that's why it's so important to look at them in that broader context.
Yeah.
You know, to consider not just the letter of the law, but also like the real world impact on individuals and communities.
Okay, well, we've covered a lot of ground here.
Yeah, we have.
From like the specifics of the laws themselves
right.
to the systemic issues that they raise.
Yeah.
It's clear that this is like a multifaceted problem that requires really thoughtful solutions.
It does, and thankfully, as the report points out, the movement to reform these laws is gaining some real traction.
Oh, that's good to hear.
Yeah.
Like people are starting to recognize that we need a more just and equitable approach to HIV.
Yeah, absolutely. But before we get into like potential solutions, let's just take a second to gather our thoughts.
Okay.
And when we come back, we'll explore what a more positive future might look like and how we can all contribute to meaningful change.
All right, so we're back and we've talked about like the reality of Ohio's HIV criminalization laws.
Yeah.
What they actually say, what their impact has been, and all of the kind of systemic issues that they raise. So now I want to kind of shift gears and think about solutions.
Okay.
Like if we could hit the reset button and design laws that actually like truly serve public health and individual well-being, where would we even begin?
Well, I think the first step, and probably the most crucial step, would be to decriminalize behaviors that pose no risk of HIV transmission.
Right. Like we've talked about how it's crazy to criminalize spitting.
Exactly. It's not based on science.
Right.
And it really just perpetuates this fear and stigma.
Yeah, it seems like common sense to like align the laws with what we actually know about HIV.
Exactly. We have to acknowledge that someone with an undetectable viral load cannot transmit HIV.
Right.
That should be the basis for any law addressing HIV.
So no more prosecutions just because of someone's HIV status?
Ideally, no.
Okay.
The focus should really be on education prevention and harm reduction.
Okay.
You know, if someone is engaging in behavior that does pose a risk, regardless of their HIV status, then the conversation should be about safer practices.
Okay.
Not criminal charges.
So a more like nuanced approach that takes into account like the actual science of HIV.
Right.
And focuses on like really preventing harm.
Exactly.
Okay. And beyond decriminalization, we also have to think about those racial disparities.
Right.
That we talked about.
Yeah, those were really shocking.
Yeah, they were. So like, how do we make sure that these laws aren't unfairly impacting Black communities?
Well, it's going to take a multi-pronged approach.
Okay.
We need to look at policing practices.
Okay.
Prosecutorial discretion, and just like the role of implicit bias in the entire justice system.
So it's not just about changing the laws. It's also about changing like how they're enforced.
Exactly.
And who they're enforced against.
Exactly. We have to dismantle the systems that allow for discrimination, whether it's conscious or unconscious.
Okay. So alongside legal reform, we also need like a major investment in public education.
Absolutely.
About HIV.
Yes, to combat the stigma.
So what would those public education campaigns look like?
Well, they would have to be evidence-based.
Okay.
And designed to reach diverse communities.
Okay.
We need accurate information about HIV transmission prevention and treatment.
Okay.
All over the media, you know? We need to normalize conversations about HIV.
Yeah.
And challenge those myths and misconceptions that fuel stigma.
So kind of move away from like fear-based messaging to more like fact-based messaging.
Exactly. We need to move away from those outdated narratives that portray HIV as like a moral failing.
Right.
Or something to be ashamed of.
Yeah. And along with education, what about access to health care?
That's absolutely fundamental.
Yeah.
Everyone, regardless of income or insurance status, should have access to affordable HIV testing treatment and prevention methods, like PPAR-P.
So it's about combining legal reform with public education and accessible health care.
Absolutely. And we also need to recognize that these efforts need to be community-driven.
Okay. What do you mean by that?
Well, we need to support organizations that are already doing great work on the ground. Yeah. Providing services to people with HIV. And advocating for their rights.
So empower the communities most impacted by these laws.
Yes.
To be the ones leading the charge for change.
Exactly. We need to listen to people with lived experience.
Yeah.
And center their needs and perspectives in any solutions that we come up with.
Well, this deep dive has been really eye-opening.
Yeah.
It's clear that Ohio's HIV criminalization laws are outdated. They're harmful.
Yeah.
They perpetuate stigma.
Right.
They prevent people from seeking health care. And they disproportionately impact marginalized communities.
Absolutely.
But I'm glad that we're talking about this.
Yeah.
And that there's momentum for change.
Yeah, me too. More and more people are recognizing that we need a more just and equitable approach to HIV.
Okay, so for our listener who's now like tuned in to this issue, what can they do to like contribute to change?
Well, knowledge is power. So continue to learn about HIV criminalization laws in your own state or community.
Okay.
Support organizations that are working to reform these laws. Talk about this with your friends and family and colleagues. Challenge stigma when you see it.
So it's about taking this knowledge and turning it into action.
Yeah.
Whether it's advocating for policy change, supporting community organizations, or just like educating the people around us.
Absolutely.
We all have a part to play.
Yeah, change happens from the ground up.
Yeah.
By working together, we can create a future where HIV is treated as a health issue, not a crime.
Right.
And where people with HIV can thrive without fear of discrimination or prosecution.
That's a future I want to live in.
Me too.
Well, thank you so much for joining us on this deep dive.
It was my pleasure.
We'll be back soon with another exploration into a topic you want to know more about.
Sounds good.
Until then, stay curious and stay engaged.